In this video, I am going to tell you exactly what ingrown hairs and razor bumps are, why we get them especially after 50, the two types you need to know about, how to treat them, and the tips that will actually prevent them from coming back. Stay with me. Everything you need is right here. I'm Dr. Rebecca Ross, a certified women's sex therapist with over a decade of clinical experience working exclusively with women's health, women's bodies, and women's intimate well-being. Today we are talking about something that has a very official medical name, pseudofolliculitis, and a very real impact on the confidence and comfort of millions of women, particularly those of us over 50. If you are new here, welcome. This channel is dedicated entirely to women's sexual health, intimate wellness, and the conversations your doctor rarely has time to have with you. Hit that subscribe button right now because every single week I am bringing you research-backed, clinically grounded information designed specifically for women over 50. You deserve accurate answers. That is what we do here. The relatable diagnosis. Let's be honest with each other for a moment. You've probably sat in a waxing chair or stood over your bathroom sink with a razor, doing everything you thought you were supposed to do, and still ended up with painful, embarrassing bumps that took weeks to go away. Maybe you have Googled it at midnight. Maybe you have bought the serums, the scrubs, the special razors. Maybe you have just quietly accepted it as something that happens to your body. I want you to hear this clearly. You are not doing anything wrong, and you are absolutely not alone. In my clinical practice, ingrown hairs and razor bumps in intimate areas are one of the most common concerns I hear from women over 50, and one of the least talked about. Women come to me embarrassed, sometimes after years of silent discomfort, not realizing that what they are experiencing has a name, a mechanism, and most importantly, a solution. We call them razor bumps, shaving bumps, waxing bumps. Clinically, the condition is called pseudofolliculitis, and before you think this is just a cosmetic inconvenience, I need you to understand what is actually at stake if we leave this untreated. Repeated, untreated ingrown hairs can cause permanent hyperpigmentation, those dark patches that linger long after the bump is gone. They can cause scarring beneath the skin surface, and in women with deeper skin tones, they can trigger keloid formation, raised, thickened scar tissue that is extremely difficult to treat once it develops. This is not vanity, this is your skin's long-term health. And after 50, when our skin is already working harder due to hormonal changes, the stakes are higher than ever. I know I am guilty of rushing through a shave or skipping the pre-wax exfoliation because life is busy. Most of us are. But by the end of this video, you are going to know exactly why that matters and exactly what to do instead. How it works. Let me show you exactly what is happening inside your skin, because once you see it, it all makes sense. This is a healthy hair follicle. The hair grows upward, exits through the skin surface, and that is the end of the story. No problem. But here is what happens when the hair removal process, whether shaving or waxing, combined with dead skin cell buildup, disrupts that exit path. The hair tries to grow back, but instead of reaching the surface, it gets trapped. It curves, it grows sideways or back down into the skin itself. Your immune system sees that trapped hair as a foreign invader, and it sends an inflammatory response. That is your bump. Now here is something most people, including many healthcare providers, do not explain. There are actually two distinct types of ingrown hairs, and knowing which type you have matters for how you treat it. Type 1, extra-follicular. In extra-follicular ingrown hairs, the hair actually exits the follicle successfully. It breaks through the skin surface, but then it curves back around and re-enters the skin at a nearby point. This is the most common type after shaving. Why? Because shaving cuts the hair at a sharp angle, creating a fine pointed tip. That sharp tip is essentially a needle, and it finds its way back into the surrounding skin with remarkable ease. After 50, this becomes more likely because our skin loses elasticity. The skin surface is less taut, meaning there is more opportunity for that curved hair to pierce back through. Type 2. Trans-follicular. In transfollicular ingrown hairs, the hair never escapes the follicle at all. It grows within the follicle channel, but in the wrong direction, laterally or downward, remaining fully beneath the skin surface. This type is more common after waxing because when wax breaks a hair rather than removing it cleanly from the root, the remaining hair fragment can change growth direction entirely. Transfollicular ingrowns tend to be deeper, more painful, and more prone to infection. For women over 50, both types are more common than they were in your 30s or 40s, and the reason comes down to 3 hormonal and biological shifts. First, reduced estrogen means slower skin cell turnover. Dead skin cells accumulate on the surface faster than they shed, creating a thicker barrier for hair to push through. Second, decreased collagen means the skin around your follicles is less structured and supportive, making it easier for hairs to deviate from their intended growth path. Third, hormonal hair texture changes. Many women notice that body hair becomes coarser and more wiry after menopause, particularly in the pubic region. Coarser, curved hairs are structurally more likely to ingrow. This is not a failure of your skincare routine. This is biology. And biology has solutions. The tiered solution. Now let's talk about what you can actually do. I am going to give you a tiered menu of solutions, from the hard truth at one end, all the way to the clinical gold standard at the other. You choose what works for your body, your budget, and your lifestyle. Tier 1. The hard truth. The most effective way to eliminate ingrown hairs and razor bumps permanently is to stop hair removal entirely. I know, not what you wanted to hear, but clinically it is the truth. Given enough time, typically 4 to 6 weeks, the hairs normalize their growth pattern, the inflammation resolves, and the skin heals. For some women, this is genuinely the right answer. If you are experiencing chronic pain, recurring infections, or significant scarring, your skin may need a full reset before any other intervention will be effective. Tier 2. Technique and routine correction. If stopping hair removal is not an option for you, the next most powerful intervention is correcting your technique and building a proper routine around hair removal. Before you shave or wax, exfoliate. Not on the same day, ideally 24 to 48 hours before. Use a gentle chemical exfoliant containing glycolic acid or salicylic acid to dissolve the dead skin cell layer and clear the path for hair regrowth. Physical scrubs can work, but use a light hand. Aggressive scrubbing on postmenopausal skin causes micro tears that worsen inflammation. When shaving, always shave in the direction of hair growth. I know going against the grain feels closer, but that angled cut is exactly what creates the sharp hair tip that re-enters the skin. Use a single blade or safety razor where possible. Multi-blade razors use a lift and cut mechanism that cuts the hair below the skin surface, which dramatically increases ingrown risk. Never shave dry. Always use a fragrance-free moisturizing shaving gel or cream. Fragrance is an inflammatory trigger on mature skin. If you wax, request hard wax rather than strip wax for sensitive or intimate areas. Hard wax adheres to the hair itself rather than the skin, reducing trauma significantly. And never wax over active bumps or broken skin. After any hair removal, apply a fragrance-free, alcohol-free moisturizer immediately. Wear loose, breathable cotton clothing for at least 24 hours. Tight synthetic fabrics against freshly treated skin create the exact friction and heat environment that triggers razor bumps. Tier 3. Over-the-counter treatments for active bumps. If you already have ingrown hairs or razor bumps right now, here is your treatment protocol. Start with a warm compress. Apply a clean, warm flannel to the affected area for 5 to 10 minutes twice a day. This opens the follicle, reduces inflammation, and in many cases allows a shallow ingrown to surface on its own. Do not pick, squeeze, or attempt to dig out the hair with tweezers unless it is clearly visible at the surface. Forcing it causes scarring. For inflammatory bumps without infection, a mild over-the-counter hydrocortisone cream applied twice daily for 3 to 5 days reduces redness and swelling quickly. Do not use this long-term or on broken skin. For chemical exfoliation of active areas, look for products containing glycolic acid, lactic acid, or salicylic acid. These dissolve the dead skin barrier non-abrasively, releasing trapped hairs and preventing new ones from forming. Look for fragrance-free formulas targeted at sensitive or mature skin. For stubborn or recurring cases, speak to your GP or dermatologist about topical retinoids. Retinoids increase cell turnover, which is precisely what slows after menopause, and they are clinically proven to reduce ingrown hair frequency significantly when used consistently. If a bump becomes increasingly painful, swollen, warm to the touch, or begins to discharge, that indicates a bacterial infection. Do not treat this at home. See your GP. You may need a short course of topical or oral antibiotics. Tier 4, the gold standard, laser hair removal. If ingrown hairs are a chronic recurring problem that is significantly affecting your quality of life or causing ongoing skin damage, the clinical gold standard solution is laser hair removal. Laser hair removal works by targeting the melanin in the hair follicle with concentrated light energy, permanently disrupting the follicle's ability to produce hair. No follicle, no ingrown hair. For women who have dealt with this problem for years, the results are genuinely life-changing. Visual, on-screen text, important. Skin tone and laser safety. However, I need to give you an important clinical warning, particularly for women with deeper or darker skin tones. Traditional laser systems, particularly older IPL devices, target melanin in the hair, but they can also inadvertently target melanin in the surrounding skin. For women with brown or black skin, this creates a real risk of burns, hyperpigmentation, and permanent skin damage. If you are considering laser hair removal and you have a medium to deep skin tone, you must seek out a clinic that uses an NdYAG laser. This wavelength is specifically designed to bypass surface melanin and is clinically validated as safe for darker skin tones. Do not accept treatment at any clinic that cannot confirm which laser system they use. Always request a patch test. Always. Any reputable clinic will insist on one. Let's bring everything together. Ingrown hairs and razor bumps, pseudofolliculitis, are not a hygiene problem. They are not a sign that you are doing something careless or wrong. They are a biological response made significantly more likely by the very real changes that happen to women's skin after 50. Slower cell turnover, reduced collagen, hormonal shifts in hair texture. You now know the two types, extra-follicular, where the hair exits and curves back, and trans-follicular, where it never surfaces at all. You know why they happen, and you have a full tiered toolkit to address them. If you are dealing with mild occasional bumps, adjust your technique and add a chemical exfoliant to your routine. That alone will make an enormous difference. If you have active bumps right now, warm compress, hydrocortisone for inflammation, and a gentle glycolic acid product to free the trapped hair. If this is chronic and affecting your skin long-term, speak to a dermatologist about retinoids and seriously consider a consultation for laser hair removal with an appropriately qualified clinic. And above all, please do not suffer in silence. Your intimate skin health is real health. It deserves real attention, real solutions, and real conversation. That is exactly what this channel is here for. If this video helped you today, please give it a like. It genuinely helps this information reach more women who need it. Subscribe if you haven't already, because next week we are going into another topic that far too many women over 50 are navigating completely alone. And if you have a question, a topic you want me to cover, or something you have been too afraid to ask your doctor, leave it in the comments. I read every single one. Take care of your skin. Take care of yourself. You deserve both. I'm Dr. Rebecca Ross. I'll see you in the next one.